Okay, and we are live. Hello, web shadowers. Welcome back. Thank you all for joining us this afternoon. Today, we have the pleasure of hosting Dr. Azumah, who will be teaching us about becoming a physician leader. As always, remember that when the session is over, the Google form will be posted in the chat box and in the description of this video, and you'll have 30 minutes to fill that out. With that being said, Dr. Azumah, you can start whenever you're ready.
Yes, thank you so much, Sophia and Web Shadowers, for finding me and for creating this platform. This is awesome. When I was in medical school, I wouldn't tell you how long ago, we didn't have this. I think this is a great time for medical students because there's so much information and the information is right at your tip. So it's easy for you to get knowledge, more knowledge than during my time, whereby we have to go to the library, borrow books. I'm not envious of you all, but I just wanted to make sure you guys know how fortunate you are to be studying at this time. Again, my name is Dr. Azumah. Let's do this. Let's see. I am a board certified OBGYN. I'm a certified ICF life coach. So I do a lot of physician coaching. I work with medical students, I work with residents, I work with attendings, and I also work with public health professionals as well, basically everyone, because I'm also a public health professional and I love public health as much as medicine. I think they're both a great combination. I am the founder of Azumah Solutions, which is a coaching, obviously I said that, and consulting development company. I'm also the founder of an organization I love dear to my heart. It's called Love Your Menses. Love Your Menses started in 2019, and our goal is just to empower young girls, specifically Black and brown girls, using physiology, actually using the menstrual cycle. So we teach them the menstrual cycle and we teach them advocacy and leadership. So it's really a cool organization. We started in Boston and now we're in 5 countries. I can't believe it, but it's just amazing to be able to empower people and to work towards menstrual equity. And if you want to hear more about it, you can reach out to me later. So today, we'll be talking about becoming a physician leader. I started giving this talk, I want to say in 2019, when I graduated from public health school. So during public health, I learned a lot about leadership. I learned from a lot of leaders there. I went to Harvard's T.H. Chan School of Public Health. So we had access to great leaders. And I used to always marvel at their leadership. We're able to see leaders, public health leaders. We were able to talk to former governors for them to give us insight. So I fell in love with leadership and I said, how can I combine my experience as a public health professional and merge it into physician leadership with my expertise as a coach? So that's how I came up with this. Again, there's so many resources about leadership. So if you're interested in it, please take the time to learn more. All right, so there's no financial disclosure at all. This is what I do. I sponsor myself. All right, so I like to start with a joke. So this says, when's the last time you had a decent night's sleep? Sophia, the moderator with me today, she was talking about how, challenging medical school is. So I'm sure most of you today have not slept. I remember those days. Fortunately, I'm an OBGYN, so there are times we also do not have sleep. We also do not have sleepful nights. Okay, you know what I'm talking about. There are times whereby we have to stay up delivering and taking care of babies. So this picture is supposed to capture like the life of physicians, especially OBGYNs. We rarely sleep, those of us that do clinical and hospital practice. All right, so we're going to start with objectives, right? This is physician leadership. I remember when I was asked to give a presentation on web shadowers, they're very awesome. They give you the choice of topics. So yes, I could teach on fibroids. I could teach on endometriosis. I could teach on infertility. Yes, I could. But so can someone else, right? Because there are many OBGYNs. But I chose to teach on physician leadership and they were gracious enough to allow me to bring this topic to you guys. Okay, so we'll start with what's the difference between a physician manager from a physician leader? Just remember that a lot of people in leadership that are physicians are really managers and not leaders. Types of leadership styles, some tools to help each of us to become effective physician leaders. I love emotional intelligence, and you're going to see that as we dive deeper into this presentation, because something about emotional intelligence and also coaching is you learn that you can learn anything. Like you can learn to become who you want to be. I remember prior to being a coach, I thought like personalities or affects, right? Like, oh my goodness, I'm an introvert, so I have to do introvert-like things, not knowing, but I have a desire to be a speaker. What we've learned is you can retrain yourself. You can retrain yourself. You can be adaptable and change things. So I believe physician leadership is something that any physician that desires leadership can adapt and learn from. So that's my own biases that I'm bringing to today's talk. All right. So I did say there are a lot of physicians that are managers and not leaders. So I want to expound on it. So a manager, right? Like think about a grocery store manager. They plan, they coordinate, they negotiate hands down. But leadership is different. Leaders influence. Leadership is not a title. There are people that are leaders that have no title as an administrator because maybe they don't want it. Maybe they don't want to get involved in hospital politics, but a leader influences. A leader is innovative. A leader empowers. A leader is a decision maker. We're not saying managers cannot have leadership positions or leadership tendencies, but what we are saying that there's a difference. All right. I wish anyone participating would be able to share or type in the chat who is a leader that you admire, you know? So when I was going to public health school and learning about leadership, the question they asked me was, who is a leader that you admire? And I thought, Dr. Rovi. Dr. Rovi was my partner. See, he wasn't even the chair. He wasn't even the vice chair. He was just my colleague. But anytime I think of my first experience after residency, I think of Dr. Rovi as a leader. He just displayed the qualities that I'm going to share today. He motivates, he's innovative, he was listened to, he was well respected. So that's a leader, right? So yeah, so just whenever you see someone that's in leadership and you think there's something remarkable about that person, take the time to reflect and say, why? Why do I admire this person? And the skill set that you can come up that describes that person, a skill set that you can try to adapt to and make it yours. All right. Who's a leader you admire? All right. So I was told to have a case study. So this is almost a real life story I've heard. A physician realizes that since there's a shortage of staff due to an increased number of COVID infection, he has been working longer hours and not spending time with his family. However, productivity has decreased in the institution for multiple reasons. The administrators were concerned, right? Because revenue is an important facet in managing hospitals. So the administrator wants physician A to work more hours. Remember, physician A has been working a lot of hours. So they're asking this physician to increase their workload. Physician A stood up for himself and disagrees. And he proved that it's impossible to work more hours and still maintain patient safety and also decrease physician burnout. The administrators were angry and upset that physician A stood up to them. So they decided to create a reason to place the physician on leave for insubordination. So my question to you is, what kind of leaders were those administrators? Are they effective leaders? Are they just managers? What type of leadership style did they display? Towards the end of this talk today, I hope you guys will be able to come up with your conclusion, because for some of you, the administrators are right. A physician speaking up about their work hours that's wrong, right? So It depends. I don't think there's any right or wrong answer. It's going to be based on your morals and what you believe. Very, very subjective. All right. So in contrast of a good leader, let's think about a lousy leader and why, right? So just think, you know, that's a person that comes to my mind, you know, and the person is a lousy leader because the person wanted just his way or the highway. Any disagreement is personal, you know. So to me, that's a lousy leader. And maybe that person even displays more of a managerial skill than a leader. But again, it is your judgment to decide that. Again, I stressed earlier on, leadership is not a position nor a title. It's actually an action and an example. That's what I think. And I think a lot of people in the coaching space, in the positive psychology space will agree with me. Leadership is not a position. There are people without position. Dalai Lama, right? He doesn't really have, he's not like a president, but he's a leader that is well respected because of his actions, because of his examples, right? Or our former First Lady, some people consider her a leader because of her example and action. For example, she says, whenever they go low, we go high, right? A lot of people in our circle, we record her and we use that quote all the time. We say, whenever they go low, we go high. Whenever they go low, we go high. So for example, she definitely will be one I consider a leader. All right. All right, there's this caption. Great leaders, they inspire people. Why poor leaders don't care about people's growth. So my message for you guys today is, I wish you all would become great leaders. I know you guys can. I really, really, really believe in our current generation, yes, Gen Zs. I really do, because you guys are different and I admire it. You guys are bold. You guys want change. I do know there are also non-traditional students listening today. I respect you, I admire you, I love it. But let's focus on the majority today. And the majority of people in medical school are Gen Zs. And you know, you guys are amazing. I really do. As a minority woman, I love it. I love how you guys seek justice. At least the ones I work with, I work with pre-med students, and I love their enthusiasm. I love the ability to want to learn. I remember there was a patient of ours that needed to be seen by a consultant, but there was something, the kind of insurance that the person had requires prior authorization. However, this person doesn't have a primary care physician. Again, I'm an obstetrician. So I had to try to advocate for the patient because the patient really needs to see a doctor in a few days. So we called, they were like, no, we need this, we need that. And I was like, back and forth. I'm the primary care physician. I am also, as an obstetrician, I'm recognized as a primary care physician. Why can't my referral work? So I keep going back and forth. And definitely my coaching skills kicked in, and I asked the person on the phone, I said, ma'am, how can you help me help this patient? There was a pause. She said, you know what? Let me see what I can do. She then came back to me and said, you know what? We have an appointment for her. It was like, yes, it was like great success. So my medical student, she's going to be a medical student. She looked at me. She said, Dr. Azumah, how did you break through that fake barrier to entry? Like that fake barrier to entry. Because of her, I now call things fake barrier to entry. I was like, you know what? As a minority woman in the United States, I've learned to be persistent, because I know that there's so much fake barrier to entry, So I say that because I admire the Gen Zs. You guys like to learn, you guys are understanding. And I just believe that things are good, but they will get better. All right. All right. And another qualities of good leaders, clear communicator, good example, recognition, inspiration. And we're going to go deeper into these qualities as we go along. All right. So types of leadership styles, again, that could be a whole lecture, but the main ones that you see in a lot of books, textbooks are like transformational leaders, servant leaders, democratic leaders, authoritarian leaders. The example I gave to you in our case study, that person most likely is an authoritarian leader, my style or no other way. You disagree, you will be punished. So that's the kind of leader. While a servant leader is one that I believe I display. They want to serve, they want to help people, they want to motivate people. Then a democratic leader is one that wants consensus all the time, which is good. Again, as a coach, I would say that maybe there are times whereby we have to have all of those qualities. There are times where you have to maybe be authoritative, and say, this is my decision. This is what's good for the organization. This is how we are going to do it. And then there are times where you want to serve people. And then there are times you want consensus. And then sometimes you have to be a transformational leader. A lot of people during this COVID needed transformational leaders that can calm people as we switch to telemedicine, as we switch to like the cyberspace, So there are times, I guess, that you need those qualities. I would say so, but someone else could disagree, and that's okay. So the question now is, why do we need good leaders? Why do we need good physician leaders? Because the time needs it. There's a shortage of physicians. But the second problem is a lot of physicians are quitting medicine at a young age because they're just tired. And I think a lot of physicians are realizing, Gen millennials, they're realizing that we could do many other things. We can become entrepreneurs, we can do multiple things. So you know what, maybe clinical medicine is no longer for me. I can use my degree to help other people in different ways. So, some people, yeah, that's good for them. But when they're living in a large number, they're going to worsen the physician shortage. So we need to talk about this. We need to deal with it. And I'm glad the American Medical Association is aware of it and they're working hard to fix this problem. All right. So I didn't find a most recent data. Again, I said I've been doing this talk since 2019. So I was like, okay, with the COVID and changes, I will find new data, but really I didn't find much. So in 1983, 76% of physicians owned their practice. Those of you that are entrepreneurial or come from a family of entrepreneurs, you guys know that there's a difference when you own your practice. You make decisions, maybe better decisions, I would say, but you make decisions for your practice without having to go through many red tapes. But now 47.1% in 2016 of physicians own their practice. So now most of us are working for someone or being more hospital employed. This is different, right? It's different times because now we have to abide by the rules of the hospitals that are run by not physicians, but people with maybe business degree, leadership degrees that might not understand clinical knowledge and how it goes. So there's room for contention. More hospitals are merging into one. So yes, okay, maybe if you worked in a hospital, but it's a smaller hospital with a smaller chain of command, now you're merging with a bigger hospital, so it's hard to maneuver. Some physicians are like, you know what, I'm just gonna quit. Another thing that we've been seeing since 2019 and has gotten worse with the COVID is physician burnout, and we'll talk more about it. All right, so the question is, do physicians trust their hospital employment? Let's see what the data has to say. So in 2018, 57% of physicians do not agree that the hospital employment is positive. So almost 58% of physicians that work in hospitals don't agree that the employment is positive. So that's pretty not good compared to, 2012. I can't see this, 1 second. Uh, so hospitals, since they are becoming one of our major employers of physicians, will need to learn to collaborate with physicians and give them back their autonomy, so that we would decrease the burnout rate for physicians and decrease the attrition rate for physicians. Because I mean, it takes multiple years, I want to say 13 years to train to become an independent physician. And after that, work for a few years and quit. For some of us, because I'm decreasing my clinical practice as an OBGYN, for some of us, that's okay. But the cost is really high, right? You work all those years to eventually decrease it. So it's something that I would almost say it's a public health problem, right? It's almost a public health crisis, in my opinion, because I do wonder, like, as I get older, will I have enough quality physicians to take care of me? That's something I wonder. Thank you. I might sneeze. Okay. All right. So Dr. Hunton said, believe it or not, hospital administrators do not always like to hear about problems with poor care. So basically, what he was trying to say is collaboration is very important, and collaboration should allow hospital administrators to listen to physicians. If physicians talk about poor care, they should not be punitive and create a sham peer review. They use the peer review system as a way to limit physicians from speaking up, so there are tools that the hospitals have made to inhibit accountability, to instill fear in physicians. Again, I love to give this talk because a lot of you guys don't think about this, and yes, don't think about it, just remember it later on. But there's situations post medical school training that you need to know about, especially if majority of physicians are now working for hospitals. All right, so let's talk about burnout. All right, so the burnout rate is really, really increasing. And I believe this study was from 2012. A more recent study, I want to say 2014, also agrees with it that 37.9% of physicians report symptoms of burnout, just being tired, no longer interested, no more joy, no more satisfaction. And some of them say this trend is true because of the paperwork. There are multiple reasons. I had a conversation recently because I do have the opportunity to interview medical school candidates. And oh my goodness, the joy I see on their faces is so beautiful, so beautiful. And I sat down and I reflected and I shared my reflection with one of my colleagues. And I'm like, wow, there's so much joy. How come I don't see that joy in my peers that I work with? Like, why is there no enthusiasm? So it's a situation that I feel like we need to change. All right. So basically, this is a study in 2017 that just shows burnout rates by specialty. I believe there might be a recent one, but I don't have the data with me. So critical care, 48%, OBGYN, 46%, plastic surgery is 23%. Oh my goodness. I guess they don't get burnt out. I think most plastic surgeons own their practice. So maybe that's why, maybe that's a co-founder. I don't know, but that's it for you. All right. So the question is, no one is immune to burnouts. We'll see the study that I'm going to share. Excuse me. Sorry, turn it off. Excuse me. You see the study that I'm about to share shows that burnout is present in people that are middle age. Is also present in both genders, although you can see from here that 48% of women display burnout more than men. And that could be because most times women are also caregiver at home. So they come to work, they perform at the same level as men, and then they go home and also take care of their kids. It becomes so overwhelming at times. So that could be the reason why we have more female that responded that they have more burnouts. Sorry, I don't know if you can hear my dog. Can you guys hear my dog? Is it too loud? Is it too loud, the dog? Or you guys can hear it?
You can hear it in the background, but it's okay.
Okay, I'm so sorry. I'm so sorry.
Don't worry.
Okay, thank you. Oh my. Oh, so sorry. They're excited. All right. All right. So what are some factors that lead to physician burnout? Again, a lot of paperwork, spending too many hours at work. So 39% said so. And then 26% said lack of respect, right? Because before now, like we saw earlier on, physicians own their practices. That's why we cannot unionize, because most times we were like the employers, but things are changing. So because of that, they were used to be leaders. A lot of people, I would say, went into the medical field because they want to make decisions, not just decisions on like clinical care, but also how things flowed in the medical industry. But that is changing. Some people say insufficient compensation. I'm sure people in public health will laugh because they always think our salary is too hefty. I don't agree with them. The lack of control, feeling like a cog in a wheel, lack of respect from patients, just 16%, governmental regulation, decreasing reimbursement, emphasis on profit over patient care, maintenance of certification. So those are some reasons why some people believe they are burnt out. And I think as much as we care for our patients, it's important to care for us as well. The next one says, I can't see it, what would reduce your burnout? So they asked the physicians, what would reduce their burnout? 35% say increase compensation to avoid financial stress. 31% say more manageable work hours. I would have thought this one would be more than 31%. Decrease governmental regulation, more reasonable patient workload. So maybe if we combine 24 and 31%, that would give us 55%, which will be higher, because I really do think reasons for burnout is patient load and call schedule. Like I said earlier, burnout is problematic. The German study did show, I mean, it's common sense, but sometimes we need studies to complement what we are thinking. So there's a study that shows that there's a correlation between burnout and attrition rates, right? Why would someone continue to go somewhere when they're not happy, So I do understand it. All right. So like we're saying, there's a shortage of physicians. So why do we allow this important workforce to quit over things that we can change? A study from the American Medical Association in November 2017 showed that 1 in 5 physicians, 20% of physicians reduced their clinical hours. I'm one of the 5, while 1 in 50 physicians have left clinical practice. I mean, I've had so many of my friends, again, we could be a biased sample, excuse me. We could be a biased sample, but a lot of us are not full-time clinical physicians anymore. And I do remember most of us really were excited as medical students to begin our career.
Bless you.
Oh, thank you, Sophie. I appreciate you. All right, so here are the findings from a 2018 study of American physicians regarding the future. So this data was just basically asking, are we more optimistic about the future of our career? And 49% were somewhat optimistic, while 50.4% were pessimistic for people under 45, and people greater than age 46. Majority of them were not pessimistic, we're not optimistic about the future of medicine and where it's going. We see that both men and women were also identical. So it's not just females that are more pessimistic, but males too, We see the pessimistic scale is higher in physicians that when they are practiced, maybe they're nervous. I don't know, but that's what it shows. Again, this was gotten from physiciansfoundation.org. All right, so this is why I argue that we truly need physician leaders to bring back optimism back into medicine, to bring back that passion we all had as pre-med students. You know, I do love interviewing applicants, their joy. It's like, oh my goodness, give me some. It's like, oh my God, we really want to be a doctor so that we can make change, we could do this. And I'm like, wow, I love it. All right. I believe good physician leaders will help us to regain that optimism we once had for medicine as pre-medical students. There's now a widespread recognition that effective leadership by healthcare professionals is essential in modern healthcare. So Kumar agrees, right? We need to change our leadership style or move from being a manager to a leader. Here are some qualities that I use to measure people to determine if they are physician leaders. All right, so self-awareness, again, emotional intelligence, emotional quotient, self-regulation, empathetic. Oh, Sophia, thank you for being empathetic. I appreciate you. Self-motivated and to have good social or people skills. Again, this is from Goldman. He's the founder of emotional intelligence. Not founder, but the one that coined it. So self-awareness always begins with a strong sense of confidence. I always describe self-awareness as like taking a mirror and looking at your face to identify any pores. It takes a lot of self-confidence to do it. And it will be hard for someone without self-confidence to truly reflect and decide and base into your self-awareness to say, you know what, the way I spoke to that lady was wrong. I could do better. You know, we could tell people that are not as self-aware because they tend to be narcissistic, right? So self-awareness begins with self-confidence. So if you want to become more self-aware, you have to develop your self-confidence. And again, like I stated earlier, I do believe these qualities are things that we can all learn to be. With practice, with determination, we will get there. The ability to read and understand my emotions and how it affects my performance at work. So basically, work self-awareness is the ability to read and understand your emotion and how it affects your performance as a leader or your leadership style. The ability to perform realistic evaluation of one's strengths and limitations. Our limitations we can hide, but not forever. I do believe that we understand our limitations first, and because we have the room to improve it before others notice and before others judge us by it. I hope that makes sense. Self-awareness allows us to be retrospective, especially in times of failure, team failure. I've heard of some leaders that lie. They lie a lot. I remember one of my colleagues was telling me about this physician leader. He told her to do something and she did it, but the outcome was not that good. And they asked her, why did you do it? She said it was a team decision with the leader. The leader said, oh no, that was not true. I never said that. And my friend was looking at him like, yes, you did. But, you have to be careful. You cannot speak up sometimes for insubordination. And again, this is in the United States. Luckily, there were some nurses that were present when this leader asked her to do something. So the nurses became her witness. And how did she know to have a nurse present? She knew because when she came to work for that organization, someone pulled her aside, excuse me. Someone pulled her aside and said, be mindful of this physician. he always lies. So whenever you go to him, make sure you have a witness. All right, so those are some things to think about. So in terms of self-management, that's also very difficult. To be able to have self-control, to be able to not speak up against your leader, that's self-control. Is the ability to control disruptive emotions and to put your impulses under check. Self-management is trustworthiness, which is the ability to always be honest and maintain integrity. I think we should do that more often. I've seen a lot of people that don't do that, even a lot of physicians. Self-management means being adaptable. You know, being adaptable is necessary. If you want to continue to live successfully in this world, change is one thing that's inevitable. So you have to be able to adapt to it. I personally had a personal change. I remember after graduating from residency, I was with some friends. I was helping them at their business, and the drunk driver hit the car, and the car caught on fire. So I developed all these burns. I mean, my physical look transformed, you know, but I was grateful to God that was adaptable, that was able to move on, even in spite of the physical changes. Again, that was not what I wished for myself, but again, I share that to emphasize that change is inevitable. Bear with me, I'm having some throat irritation. All right, thank you. All right, so another quality of a good physician leader is empathy. Empathy is the ability to feel the emotions of others, which is different from sympathy. Sympathy is sharing another person's feeling, but empathy is being able to see yourself in that person's situation. I do think empathy is an important quality in a physician because it makes you understand why a patient might not be able to come in several times because they have no car or mode of transportation. An empathetic doctor would think about it and say, how can I help to facilitate that travel? What can I do? Can I incorporate telemedicine? You know, it takes some work. If you're empathetic, you go one step ahead. You won't go one step further than an average doctor because you always think that could be me. You know, a lot of us are fortunate, not based on our doing, but based on the luck of birth, right? We're lucky to be born to be in the United States. You know, we could have been in another country. We could have been in Haiti. We could have been in Afghanistan, but nature helped us be in the United States. So it takes a lot of work to just sit back and just empathize. Again, empathy is a skill set that any of us can develop. I don't think you're born with it. I mean, there's some people that have more predisposition for that, but I do think that all of us can cultivate it if we desire to. All right. So you see the difference between sympathy and empathy. The guy on the right, he's sad, crying, and a sympathetic person will be like, oh, I'm sorry, that sucks. But an empathetic person would get a seat, sit next to the person and say, I feel you. You don't have to have undergone that same situation. You just have to know how it feels when you hurt and just translate that hurt into what the person is talking to you about. And that's empathy. Another quality of a leader is self-motivation, right? You guys, as you go further in medicine, you realize that good leaders are most times not celebrated in their lifetime. They tend to have a day in the spotlight after they are dead. We can see Martin Luther King Jr., right? So most good leaders are not motivated by external factors, by awards and whatnot. They're intrinsically motivated. The motivation comes from their core for who they are. They're also driven to achieve success for the sake of passion. I want to be better so that I can provide excellent care for my patient. Some tools to help you become more intrinsically motivated is to find a bigger purpose, whatever it may be. Find a big purpose, dream big, reward self, practice self-compassion. I remember a situation whereby a physician was complaining about a situation at their office. The physician is an anesthesiologist, and she was strong enough to stand up to the surgeon. The surgeon does a lot of oncology case, and the anesthesiologist did not feel like that patient should undergo surgery, felt like that patient should get palliative care. So the physician anesthesiologist refused to do the procedure. I was like, I'm not doing that, and spoke to the proper channel. However, the general surgeon found someone else to do the case, I believe a day later, and the patient did fine. So the physician A, the anesthesiologist, was thinking, I don't think this patient is well enough to tolerate surgery. I think you should bring more people into the team to give you insight. However, the patient did fine, survived the surgery, and our surgical colleagues would definitely look at the anesthesiologist and I'm like, I told you so, right? So there was a shame in the anesthesiologist, like, oh, I stood up, but it was kind of wrong. So we were encouraging her. We said, at least I said, because I've heard this before, medicine it's a practice, right? So we don't know it all. We get to learn more. We all recommend evidence-based medicine, but there are things that study doesn't yet understand, right? For example, preeclampsia in OB, we still don't get it. I mean, we're coming closer and closer, finding a peptide that regulates it, finding baby aspirin can decrease it. We're finding all this, but this disease has been in existence for so long, and yet we haven't gotten to it. So there are things that come with practice. And I always remind physicians that I coach that we're practicing medicine. So forgive yourself if sometimes your knowledge in practice is not as great as you want it to be, but keep striving to be better. All right, so social skills or people skills. A leader should be visionary, like think ahead. A leader should empower. A leader should be able to influence. A leader should be able to mentor. A leader should be able to work in teams and collaborate. A leader should manage conflict. The leader should be an efficient communicator. Conflict is going to happen. I know there's some people that are conflict evasive. You just have to, if you're going to be a leader, you have to learn to manage conflict. You do not put more fire into the flame if you can do that, but you have to pour water to calm the flame or flames. All right, so when we think about an effective communicator, we learned that in dialogue, it's a bidirectional communication, speaker-listener, all right? So when you have the platform to speak, you should limit how much you say so that you could be generous with your time so that the listener can also piggyback, right? Because most good communicators will not want to interrupt you while you're speaking. But if you keep going on and on and on and on and on and on, when would they have room to like interject? So a good speaker says a few words, and allows for the listener to respond before continuing. So I believe communication should be bidirectional, not a monologue kind of conversation. Like we talked about conflict. Conflict is inevitable in leadership, in our world, in our day-to-day lives, in our relationships, with even our classmate, roommate, is just present. And in the coaching world, project management world, if you do project management, which I do, is they tell you not to avoid it. Actually, it's a necessary tool sometimes to identify cracks in an organization, in a situation. So conflict is not a negative thing. It becomes negative if it's not well contained. It becomes negative if the two people in that conflict do not leave their ego to focus on the solution. Conflict is expensive when not handled well. Like you see a lot of conflicts in countries, a lot of wars. I remember when I was in graduate school in public health, I used to look at conflict, and some people just start wars over nothing, things that could have been settled. So it's very, very important. I still remember a situation whereby I was called to settle a conflict between two people. It was a landlord and a tenant. The landlord was upset with the tenant was upset with the landlord, and they called me, to try and decrease the conflict. And I was able to negotiate, and we settled it. They became friends, before they were going to go to court and do all of this. But the truth is, we're mostly very good people, and we all want peace. So if we can contain conflict, that would be great, especially in organization, because prolonged conflict can lead to people quitting. And high turnover rate is very expensive. I think there was a study that shows it costs 3 times one's salary to replace people. You guys know in medicine, you have to hire somebody, the person would have to charge you to recruit someone. And then if you're recruiting someone from out of state in places that have low supply of physicians, you have to pay for their relocation. You have to give them some money. It's just expensive. So it's best to just manage your current workforce so you don't have to have as much turnover. Conflict affects the entire organization. We call it the shadow effect of conflict. Have you gone somewhere? You just feel like, oh my goodness, this place is too tense. If you speak to someone in that organization, they would tell you that, oh my goodness, the manager doesn't like this person doesn't like this person, it just triggers. So let's decrease the shadow effect of conflict. The opposite of conflict is collaboration. So let's increase the shadow effect of collaboration. When you walk into a household where there's so much love and joy, you see it from the parents to the kid. Everyone is excited, everyone is happy. You go and you're like, whoa, this feels good. You can just tell. That's the shadow effect of collaboration that you see. This terminologies were, I guess, invented by some of my professors at Harvard. It's called A Guide for Meta Leaders. Meta, isn't that the new logo for Facebook family? Yeah, that's cute. All right, so conclusion, let's all work together using these principles to become outstanding physician leaders, because we do need to decrease the attrition rate. We're in a changing time. The leadership style that we practiced before, that were patriarchal, is changing. We see Generation Z would not entertain it, and women are in the workforce, and most of us wouldn't entertain it either. So let's come to a compromise and change. Change is inevitable, and effective leader welcomes change. I'm not saying your emotion it's happy for it, but no matter how you feel, you accept the fact that you have to change. Let's all lead with excellence and create a shadow effect of collaboration. Right, physicians are known to be extremely smart with a huge IQ or a high IQ. You know what? Let's develop our emotional quotient so that we can regain the optimism we once had as pre-medical students. So there's a quote and then we'll come to Q&A. So Mr. Katz DeFries, he's a big leader in psychoanalysis for leadership. And he said emotional intelligent leaders tend to make better team players and are more effective at motivating others and themselves. So yes, I do believe and I agree with him. Again, I could be biased because I am a coach and a public health professional, as well as a physician, but I do believe emotional intelligence is key. I have a child. I have made a rule in my mind, and I say to her, I will not focus on her school intelligence. I will focus on her emotional intelligence. And you ask why? It's because if she's emotionally intelligent, she would be academically intelligent because she'll be intrinsically motivated to do better. Thank you. Again, there are many ways to meet me. I'm the co-founder and president of Love Your Menses. So if you Google us or type email, you will see me. This is our email, loveyourmenses.com. I'm also the CEO of Healthy and Uplifted, a platform that you can find on YouTube and Facebook if you want to hear more of the work I do. Now we can have the Q&A. And thank you again, Sophia, for this opportunity. All right, bring the questions. Let's go.
Thank you so much. This was a wonderful talk. We have time for a few questions.
Okay.
So first of all, let me pull these up. One question we have in the chat is, how are older leaders versus new leaders trying to bridge the gap of mental health in the medical field and adjust to this new world we live in?
That's a good question. That's a very good question. I guess those that are not open to mental health are quitting, because mental health is important, and those that are open to it are embracing it. Again, it's our medical field is a great field. It's old and filled with intelligent people, type A personalities. So it takes a lot of time for change to go through. So we're happy that the American Medical Association has put mental health as one of their main focuses, not just that, the World Health Organization. So there are a lot of organization leadership that has included this as an important topic. So they're not where they should be for your generation, but I think by the time you are my age or older, you will have a balance mental health and balance in our society. Thank you for that question.
Great, thank you. And the next question is, what would you like to see happen differently with this new generation with women physicians that wear many hats, such as being caregivers and not having as much support in the field?
I know it's a difficult one. I don't think we should not admit more females. I do think we should just change the way we do things. For my field, OB, we have seen that there's more trend in having laborers, right? Because before, OB was just crazy, right? So those of you that know obstetricians or have taken that rotation, the traditional way is you do call, and during your call, you're delivering babies, you're answering consults, you're taking patient to the surgery, and then the next day, you would then go to clinic, see patients, and then you have to go back and do your chats. Then you have to study. So there's no time. Where's your family? I don't know how the other people did it, but I just don't understand how they do it. You need rest. So what are hospitals doing now? They're creating a laborist kind of system, or a laborist kind of system is almost analogous to a hospitalist, where those that love OBGYN can still do shift work and still have time for their family, time to do other interests. So things are changing. One good thing about organizations is it changes from the top and then it creeps down to the bottom. So we're seeing changes that are happening. Hopefully, as more women leaders go into leadership, they will continue to advocate for change so that we can have an equal platform for all of us to succeed and thrive together. Thank you.
Thank you. And are there any specific specialties that you have seen have a better work-life balance that you're able to name or identify?
Yes, yes, yes. But those specialties are like very difficult to get into. I'm sure Sophia could. She goes to a good medical school. So, there are tiers in specialty and admitting future residents. I think dermatology has a good work-life balance, okay? But, it's called to get into that field. You have to have the right test scores. And then we have radiology as well. Very, very good field. So all the fields, non-surgical fields that are high paying tend to have a good work-life balance, in my opinion. But again, not everybody wants to do that, and not everybody can get into those specialties.
Great, thank you. And we have one final question, and that is, how do you find discipline or motivation to not procrastinate and get done what you need to get done in the day?
Wow. Okay, can I answer that in two folds? Okay, so I'm gonna answer it in like real life, and then I'm gonna answer it in like a coaching response. In real life, I've heard this meme and I love it. It says, people procrastinate because they can get the work done in the last minute, right? Like, I'm not advocating for procrastination, but I do believe that those of us that do procrastinate, we still find a way of getting it done. So it becomes a cycle that just works, okay? But as a coach, all right. So if a client comes to me and say, oh, I need you to work with me on procrastination, I would sit with the person and say, how does procrastination make you feel? Does it make you feel guilty? Does it make the work you perform lower quality? Is it affecting your grade? And if that's the case, then we need to find solutions. So solution is to create deadlines, not the final deadline for submission, but the deadline that you have to complete it. And you have to be very, very motivated to go with your checklist and your deadlines. And if you can get a coach, great. Again, maybe it's a plug for coaches, but you can also have your colleagues keep you accountable. You can have someone that's a mentor keep you accountable. You can have your family friend keep you accountable. The person doesn't have to be in medicine and say, you know what, I have this deadline coming up. I want to be done and I want to submit this paper to you. I'm thinking about papers because my last training was public health, whereby I wrote papers. I need to submit these papers to you on the 9th. The final deadline is the 11th. There are tools that you can have in place to keep you accountable. But again, for some people, procrastination works. But if it's affecting the quality of work and you feel you need to change it, call me. We can work that out. Thank you.
Thank you so much. Those were all the questions we have. Once again, thank you so much for coming and giving this talk to us. It was absolutely wonderful. I know I learned so much. I'm sure all of our viewers did too.
Thank you. And I'm ready. Anytime you're ready, I can teach you about fibroids and whatnot. So physiology or whatnot. So let me know if you want me to come back. But I do believe
we'll have to have you back.
Thank you. I just do believe that we need more physician leaders, and this is an important topic. So thank you. Go ahead, Sophia. I'm sorry.
Thank you. Just quickly for all the viewers, the Google form has been posted in the chat. You guys have 30 minutes to fill that out. And yeah, once again, thank you so much, Dr. Azumah.
Thank you, everyone. I believe in you.